Hi, my name is Chelsea Flores, and I'm a master's student at Bushnell University, and today I'm going to be talking with you about diabetes mellitus type 2. Diabetes mellitus is a group of metabolic disorders sharing the common feature of hyperglycemia caused by defects in insulin secretion, insulin action, or most commonly both. More specifically, type 2 diabetes is a complex disease that includes genetic and environmental factors and a pro-inflammatory state. There is no evidence of an autoimmune basis like there is with type 1. According to the American Diabetes Association, diabetes affects more than 30 million children and adults, or more than 9% of the population, of which about 1.2 million have the form of diabetes called type 1, while the remainder have type 2. Approximately 1.5 million new cases of adult diabetes are diagnosed each year. Diabetes is the leading cause of end-stage renal disease, adult-onset blindness, and non-traumatic lower extremity amputations. These are all complications that occur with progression of the disease and poor compliance. There has been an increase in sedentary lifestyle, lack of exercise, and poor eating habits, which have greatly contributed to the rise in type 2 diabetes. This has even started to affect children due to consuming processed foods, carbohydrates, and excess amounts of sugar. Roughly 90% to 95% of individuals who have diabetes have type 2. It is not uncommon for individuals to have type 2 diabetes and be completely unaware. The American Diabetes Association shares the clinical manifestations such as increased thirst and hunger, frequent urination, fatigue, blurred vision, slow healing sores, frequent infections, numbness, tingling, or pain in the hands or feet. These patients are prone to wounds, especially on their feet. It is so important that for people with diabetes to be educated with proper foot care, such as checking the bottoms of their feet, cleaning their feet well, trimming their nails, and wearing appropriate footwear. Failure to do so could cause painful, slow-healing wounds and possibly amputation. Unfortunately, 84 million adults in this country have impaired glucose tolerance or prediabetes, which is defined as elevated blood sugar that does not reach the criterion used for an outright diagnosis of type 2 diabetes. Prediabetes is a term that is used for individuals with type 2 diabetes and is defined by one or more of these factors: a fasting plasma glucose between 100 and 125 milligrams per deciliter, a 2-hour plasma glucose between 140 and 199 milligrams per deciliter following a 75-gram oral glucose tolerance test, and or a glycated hemoglobin, also known as an A1C level, between 5.7 and 6.4%. Type 2 diabetes is caused by both a peripheral resistance to insulin action and a secretory response by pancreatic beta cells that is inadequate to overcome insulin resistance. This image shows the difference between a normal pancreas and what is happening to a pancreas that has type 2 diabetes. Insulin resistance is taking place in the adipose tissue, the liver, and skeletal muscle. Glyconeogenesis is the production of glucose that takes place in the liver, but with type 2 diabetes, this fails to occur, which then causes the fasting blood glucose to continue to increase. There is also a failure in glucose uptake and glycon synthesis, which occurs in the skeletal muscle after a meal. This is what causes the glucose level after a meal to be high. Insulin resistance also causes the failure to stop the activation of hormone-sensitive fat breakdown in the adipose tissue. This leads to too much triglyceride breakdown in adipocytes, and there are high levels of free fatty acids circulating around. Obesity affects insulin resistance significantly. Our textbook shares that excess free fatty acids overwhelm intracellular fatty acid oxidation pathways, leading to the accumulation of cytoplasmic intermediates. These toxic lipid metabolites can attenuate signaling through the insulin receptor and activate inflammatory pathways in the islets. This encourages beta cell abnormalities. If people with type 2 diabetes do not make lifestyle changes, such as a healthier diet and exercise, there are a greater risk of a lot of complications. The body can only compensate for so long and handle the stress that diabetes puts on it before it begins to break down. Individuals can experience complications such as heart disease, hypertension, hyperlipidemia, stroke, neuropathy, nephropathy, slower wound healing, and poor vision. Type 2 diabetes is usually considered to develop among adults, but children and adolescents have been getting diagnosed at an alarming rate due to obesity, poor diet, and lack of exercise. Native American, Hispanic, and Asian ethnicities have been affected the most. Type 2 diabetes also has a strong connection to family history and lineage. As mentioned before, diabetes is on the rise in the United States, but India and China are the biggest contributors to diabetes worldwide. The mortality rate from diabetes varies across countries, with middle and low income nations accounting for almost 80% of diabetes-related deaths and nearly double the mortality rates observed in high income nations. Diabetes is ranked among one of the top 10 killers in the US. According to the CDC, in the past decade, the annual rate of new cases of diabetes among US adults has been going down overall. This is great news, but unfortunately, the focus has now shifted to young adults, adolescents, and children. The rate of new cases is continuing to grow rapidly. Nearly 1 in 5 adults aged 12 to 18 years and 1 in 4 young adults aged 19 to 34 years have prediabetes. Moving on to pharmacology, one of the most common medications that is used for people with type 2 diabetes is metformin. Metformin is a biguanide, and it inhibits the release of glucose from the liver. This is to stop glucose from rising, and it also improves the sensitivity to insulin. It's not uncommon for people on metformin to have other comorbidities, and usually it is paired with a statin or a beta blocker. Another drug that may be used is Pramlintide, also known as Simlin. It is an amyline mimetic, and this drug helps regulate glucose and slows food from traveling through the stomach. Since it slows the absorption of food, people on this medication have also seen some weight loss and even hunger suppression. So patients need to be mindful that this drug may cause hypoglycemia, and they need to be educated on checking their blood sugar and recognizing what they feel like when their blood sugar is low. Glyphoside is another common medication for type 2 diabetes, and it is a sulfonylurea, and it stimulates the release of insulin, which helps lower glucose. Another medication that also causes hypoglycemia. Saxagliptin is a dipeptidyl peptidase DPP4 inhibitor. It slows the inactivation of incretin hormones, which increases their concentrations, and it reduces glucose, both fasting and postprandial concentrations. Its job is to improve the blood glucose. Another drug that is seen when people have diabetes is a Torva Statin, or any other statin. It is a HMG-CoA reductase inhibitor. The goal of this drug is to reduce cholesterol, and this is done by inhibiting an enzyme which is known as 3-hydroxy-3-methylglutarate coenzyme A reductase, and this enzyme is used as a catalyst to synthesize cholesterol. And the focus is to lower the LDLs and total cholesterol while increasing the HDLs. Many individuals who suffer from type 2 diabetes may also suffer from high cholesterol. They are commonly put on a statin to help reduce their cholesterol, and if it is uncontrolled and goes untreated, the patient is at greater risk for heart disease and stroke. Ultimately, children, adolescents, and young adults are being diagnosed with type 2 diabetes at an alarming rate. To reduce the risk of type 2 diabetes, it is important to make healthy lifestyle choices such as consistent exercise and a well-rounded diet, avoiding processed foods and excessive amounts of sugar. Fortunately, type 2 diabetes can be reversed if lifestyle modifications are made. When this disease is not treated, it can be life-threatening and cause permanent damage to the body. It is our job as nurses to provide education to these patients, explaining their disease and risk factors so that they can make the appropriate changes to manage or even eliminate type 2 diabetes. And here are my references. Thank you so much.